Chairman.
Welcome to the November meeting of the Pitt County Board of Health. We'd like to start out by calling the meeting to order. Are there any public comments this evening? Okay, hearing none, we'll move on to the review of the minutes of the October meeting. Those have been distributed in advance. So are there any additions or corrections to those minutes?
Make a motion to approve the minutes.
Second.
Motion's been made and seconded. Is there any further discussion? All in favor say aye.
Aye.
Any opposed? All right, the minutes are approved. Move on to the fiscal report.
Have your October 31st financial report. We are 4 months into this fiscal year. On the left-hand side, we have the list of the revenue streams into the health department. And as you can see, Medicaid, we are actually on target. We're showing positive variances. We did receive written notification this week from the Department of Medical Assistance that we will be receiving a check in the next 30 days for the fiscal year ending June 30th, 2016, in the amount of $423,041, which is $156,241 more than what we had budgeted for the cost study. So that is really good, positive news for us. If you follow down to the bottom, you will see the other highlights. We've had around $78,000 total increase in funds for several of our program areas, and they're listed out. If you move to the right of the sheet, you will see that our expenses, we are actually not spending as fast as we have projected this year. We will have some equipment costs with Epic. The go-live date is in April, so we're expecting that expenses to show up around February, March. And also our unadjusted revenue of $2.514,328 at the end of October compares to the expenditures of $3.1, resulting in a $592,288 deficit prior to taking in the timing issues. And once you take in the timing issues, we should have a surplus of $68,628. And I know that I just talked really fast, so my apologies.
Very good. Does anybody have any questions for Marcia? Just wanted to ask about, we had a number of retirements this past fiscal year and some unfilled positions. So will there be an opportunity to, or have we filled most of those subsequently? Or
We currently have 12 positions that we are recruiting for.
okay.
Yes, sir.
Some have just come on recently, and we hired 2 environmental health specialists last week. Had a business office staff started yesterday. And we should be hiring a physician extender in the next couple of weeks, we hope. So they're starting to fill in a little bit.
Are those positions listed on your website?
Yes, sir.
Okay. Well, certainly anyone out there in Pitt County that's might be interested, go take a look and see if there might be an opportunity for you to serve the public through the public health department. So,
Absolutely.
so we need to approve this.
Move to approve.
Okay.
Second.
Second. Any further discussion? All in favor say aye.
Aye.
All right. Fiscal report is approved. Thank you very much, Marcia. We're going to move on to old business, which you recall the last meeting we had a very good presentation. Folks from Raleigh were kind enough to come over and talk about the needle exchange program and how it related to a number of responses to the opioid crisis. We, due to the time of the meeting running over, we went ahead and delayed this to this month's meeting. So just like to open the floor for any comments subsequent to that meeting from the last time.
Mr. Chairman, I would just add, since our last meeting, we have had a declaration by the President Trump, that the opioid issue has been classified as a public health emergency. Unfortunately, as far as I know, there's no money attached to that declaration. And from the conversation that I've had with folks at the Division of Public Health in Raleigh, reaffirms that there aren't any particular monies that we anticipate getting as a result of that declaration, but we'll see about that. The other thing I'd just update you on is we did have a needle exchange. There are over 20 of them now across the state, several of them in public health departments, and that number is growing, I think, every month. The one that was started here in Greenville a couple of months ago, I had an opportunity to speak to the director this week, and she told me that things are going well there. The number of folks that are exchanging syringes is picking up. I think they've passed out more than 500 syringes and received over 300 used syringes. They've identified one client already who was diagnosed with hepatitis C, which is what we're really concerned about. And there hadn't been any problems with that operation so far. So good news.
So John, one of the issues, or one of the objectives, from what I understand, is to help these folks with the disposal of the used needles. That would be sort of what they would want from us. Is that correct, to help with disposal of used needles, or are they looking for more from Pitt County?
It's actually more. We had come to the board back in the spring, and y'all had approved us working, collaborating with them in terms of needle disposal. And so I'd already arranged with this group locally to discard their used needles for them through red boxes and hazardous waste. So we were already doing that. The Pitt County Substance Abuse Coalition and the folks from North Carolina Harm Reduction and Diane Carden, who's the director over at the other needle exchange, and the Port program representative had come talk to me about 2 months ago and said that they were really interested in having an additional site for needle exchange and wanted to see if the health department would be a possibility. What we're really asking tonight is action to, if it's needed, that we would work to become a needle exchange site at the health department also. So it would be a second site in Greenville, Pitt County.
Would those needles be provided by someone else? Would we provide those needles? What do we provide other than a site? Do we provide manpower, or what would be our role in that?
I think that's, the details are left to be determined. There are grant funds that the EChem group is using now at the Greenville site that is in existence. They're getting funded by a grant to purchase the needles and the naloxone or Narcan and the other supplies with those kits that they're handing out. So those, I think those same funds could be used to do likewise at our health department. The needles are not really expensive, so I think that's yet to be determined. We may apply for other grants that would help fund that also. And as I mentioned, we don't know yet whether the federal dollars will funnel down that would help with like purchase of needles.
So currently naloxone is not something we would be into. We would just be the needle exchange. Is that correct?
No, actually, we're already doing the naloxone. We have naloxone at the health department to use if a client should need it. Right. And we have been approved to pass that out, just like pharmacies are approved to pass to dispense naloxone to family members who are concerned about someone who might be using that might have an overdose at some time, or to the client themselves.
Just for the public, would you remind folks where the other site is that's currently operating?
The one that's here in Greenville is on Turnberry Drive, which is between Charles and Arlington, out near the Bells Fork area.
John, how are they, you said that they found one person with hepatitis. How are they, what's the process by which someone who is coming to one of those programs and possibly has hepatitis would be put, get the care that's needed so that it's not transmitted?
Right. That's a great question. We're actually doing the testing, as well as other providers in the community, but that's one of the things that we offered too, along with the getting rid of the dirty needles, was that we would offer testing for any communicable diseases, bloodborne infections. So we do that just like we do anybody else right now. So we've got funds and the capability of testing folks at risk. The state gave us that capability last year for hepatitis C. So we can do that, and we've always, had the ability to do the HIV testing as well. So they're referring patients to us, and we're referring users to them. So Ms. Carden told me, I think 4 of their IV drug users right now were referred by the health department to that facility. So I think those numbers are growing.
That's an important role, I think, for the health department to be involved.
And it's a lot of building trust also. So I don't think that, if we announced tomorrow that we had a needle exchange program, we'd have a lot of people show up, because you have to build that trust in that community to do that. But I think if the demand increases, which I'm afraid it might, that we may find ourselves needing more than one needle exchange location in the county.
It's been a good discussion. Any other questions or comments?
So we need to take action.
I think so. I'm gonna make a comment. I don't vote according to Robert's Rules of Order unless we have a tie. So, but I was been infectious disease doc, very involved in treating HIV patients starting back in the '80s at University of Texas, and I don't recall exactly what year these programs were introduced, late '80s or early '90s, but being up to our neck and having young people dying of AIDS, I was not very enthusiastic about this program when it was introduced in New York City. And I think late Senator Helms was not very impressed with it as well, as I recall. But the territory was very different then. Most of the HIV transmission occurring in the southeastern United States was not through needle sharing. It was mostly through sexual activity. And the agenda, everything's changed now with the opioid crisis that we're faced with. It's a very different situation. So over the years, and I don't know if it's a matter of having some gray hair or acquisition of wisdom or what, but over the years, having watched these programs, I've switched sides now, and so I'm very much in favor of these programs. We've got, certainly HIV is much more treatable than it was, but it's still being transmitted, and we still have new cases here in Pitt County. Hepatitis B transmission in general has improved because we're vaccinating our children starting back in the 90s, so there's a smaller pool of folks that are actually susceptible to Hep B, but again, it's still being transmitted through IV drug use. And Hep C is a whole new thing. We didn't even know Hep C was Hep C until the early 90s when the test was approved, and now it's extraordinarily expensive to treat. It's straining the budgets of Medicaid and the VA system to treat those folks with Hep C. So, like I say, I've switched sides. I'm actually in favor of these programs now. And I understand originally I thought it was a facilitator or enabler of those injecting drugs, but like I say, overall, through acquisition of knowledge and all, I think I've changed my mind since then. So,
given the primary goal is to prevent the transmission of hepatitis C through needle exchange, I would support the program, and I would make a motion that we instruct Dr. Marr to make the Pitt County Health Department as a site for needle exchange moving forward if that's needed.
I'll second that.
the second, any further discussion? All right, all in favor say aye.
Aye.
Any opposed? All right, motion passes. Thank you very much. All right, we'll move on to new business. The first one is annual review of board operating procedures, and that should be in your packet tonight. And let's see, when were these approved last time? You have to remind me.
We have to review these annually, Mr. Chairman, according to our accreditation requirements now. And we did add one section in here on page 2, G, training. Just talks about the ongoing training of the board that is provided at least annually.
Okay, so with that one update, are there any discussion or questions for Dr. Morrow? May I have a motion for approval?
So moved.
Is there a second?
Second.
Okay, any further discussion? Excuse me, all in favor say aye.
Aye.
Any opposed? All right, so those have been approved. Our next item under new business is the vendor conflict of interest policy.
And this one also should be in your packet. This also is being updated in response to changes in our accreditation requirements. It was noted that we already had a conflict of interest policy, but it did not specifically address vendors. So we've added a sentence to that policy that says all vendors shall be screened for potential conflicts of interest. No other changes.
So that's only change, okay. All right, any questions for Dr. Morrow on this one change in the policy? Hearing none, is there a motion for approval?
So moved.
Is there a second? Second. Any further discussion? All in favor say aye.
Aye.
Any opposed? All right. Motion is approved, or the policy is approved, so. Okay, let's move on. Let's see, we should likely go ahead and have your report tomorrow, and then we'll go into closed session.
Okay. Thank you, Mr. Chairman. Just a couple of things I wanted to mention. Our EPIC electronic medical record installation, as Ms. Hall mentioned, is the go-live date has been set for April 10th. A little bit later than we had planned for, but after we've been in this build phase now for about almost 90 days, I guess, I think it's going to take us to April to get it ready. So we'd like it to be here earlier, but we think to do it right, we really need to take the time to do it. And so I think the April date will work out okay for us. I did want to mention too, I've been talking to some partners in the community. We were talking about the opioid battle that we've got, but we seem to also be losing the battle against obesity here in Pitt County and other parts of the country. And so I've been talking to some partners in the community to see if we can make more of an impact against the obesity issue. The other one that's on our priority list is tobacco for the Board of Health. And you remember we tried to get a tobacco-free parks ordinance or rule passed a couple of years ago. And so we're now back with the municipalities, talking to them, and there's actually a meeting. The Aden Town Council was meeting tonight to take up that issue and vote on it. And we hope that they will pass that to give us the first tobacco-free parks in the county. Then our next step will be to go to Greenville and to Bethel that I think are ready to also address it. And they may actually do some additional discussion about public spaces, at least in Greenville. So we've had some recent complaints about smoking in public spaces here in the city. So I hope that will get addressed. I think that's it, Mr. Chairman, for my report.
All right, any other business? Well, in that case, we will go ahead and in just a moment, I'll take a motion to adjourn. We'll go into closed session, and subsequently, as we plan to
So
do.
moved.
So, was that a motion to adjourn, Rex?
So moved.
Okay, is there a second?
Second.
Any further discussion? All in favor, say aye. Aye. All right, motion is, meeting is adjourned. Thank you.
To closed session.